Starting on this Thursday, Korea's COVID-19 strategy takes on a number of changes to better address the challenges brought on by Omicron. For more on the domestic situation, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Good afternoon.
I also have Professor Lee Yoon-sang, also from Yonsei University. It's good to see you again, Professor Lee.
Thank you for having me today.
Right, Professor Kim, let's start off this session with your assessment, perhaps, of Korea's current COVID-19 situation.
I think Korea is going to follow the pattern of other countries with minor differences. Actually, the slope of the graph is very steep in USA or UK or Germany, Denmark, Israel, whatever. But I'm expecting the slope might be a little bit less steep in Korea, but there's a high possibility that the graph might be wider and maybe prolonged or broader, I would like to say, if we have stricter quarantine measures compared to other countries. That will give temporary relief in most of the hospitals and that the doctors deal with those many patients. About 1 month after the Omicron peak, the confirmed death rises in UK and United States and Australia. So is it going to be the same pattern in Korea? I don't know yet, but I would say that one stitch in time saves 9. So we have to be prepared for adults and also for children getting sick.
Right, of course. And talking about patterns, Professor, the authorities claim the daily tally may hit 120,000 towards the end of this month. Do you share this outlook?
Yes, especially with the traditional Lunar New Year holidays, where many of the people have been traveling to their hometown, and there must have been increased the level of the social gatherings. So I think at this moment it is quite inevitable to see some of the rise, especially with this Omicron variant becoming dominant variant, which as the Omicron variant is more transmissible. So with these situations, it is quite inevitable to see the rise of the cases. And in this case, the government will be slowly shifting its approach to less stricter social quarantine measures and focus more on the high-risk cases. With this situation, so in all, with this situation, we will inevitably see a rise of the COVID-19 cases for the time being.
Right, and against that backdrop, Professor Kim, the so-called stealth Omicron has been detected here in the country. We spoke about this last month, of course, and according to the Global Health Body, it's been detected in 57 countries. What more can you tell us about the traits of this particular sub-variant of COVID-19, of Omicron, of course, and how does it look to affect Korea's latest wave, Professor Kim?
Omicron is an umbrella term for several closely related lineage of SARS-CoV-2 coronavirus. And the most common one is BA.1. And now more countries in Asia and Europe, there are increasing cases of BA.2, which is also known as stealth Omicron. If we look at the Delta variant, there are more than 200 subvariants. And for Omicron, now we have about 3 or 4, BA.1, 2, 3, and further. So if we compare the two BA.1 and 2, I mean, there are 20 mutations apart. They are different. And it was first reported in the Philippines last year in November, followed by Denmark and India. And it's actually spreading more fast than BA.1. And the report from Denmark and UK says that it's more transmissible compared to the BA.1. And the severity is almost same as the BA.1. So that means this stealth Omicron is not causing that severe cases, luckily. But there's no sufficient data until now. So we have to wait and see. But no cause for alarm at this stage.
Right. Professor, starting on this Thursday, rapid antigen tests will be offered to most of the general public here. Now, in light of this reality, what do you propose to perhaps compensate for the relatively lower accuracy of these tests compared to PCR tests?
So with this rapid antigen testing kit, if you are tested positive, it will not mean if you are confirmed for COVID-19 infection, but we will go through the additional PCR testing for final confirmations. But I think what is concerned is for those people who are false negative, because we are seeing that about 35 to 40% of the false negative cases happening in many of the testing kits. So in this case, even though you are negative in the rapid antigen testing test, still, if you still have any kind of symptom, maybe it might be necessary not to rely wholly on the rapid testing kits, but maybe the testing may need to be repeated, or it might be important to consult with the doctors to make sure that if you need confirmation PCR testing.
Right, so you need to be cautious even after the rapid antigen tests.
Sure.
Professor Kim, what are some points to keep in mind when using these rapid antigen tests at home?
Well, if I tell you the basics, you have to do the nasal swab enough and mix with the test tube thoroughly, and you put drop by drop to the test device, and you wait for 15 to 30 minutes to find the result. There's a control line. It should be present every time you do the test, whether positive or negative. If that line doesn't show up, that means you need a new device and repeat that test again. So there's one line with the letter C, which means control, should be positive all the time. And there's another line, T line, we will say that if it's positive, that means you got COVID-19. But as Professor Lee mentioned, the negative result does not guarantee you are free of COVID-19. So if you are exposed, if you have symptoms, if you are high risk, or one of your family member is high risk, you might have to repeat those tests the next day. And if you have a positive result at home, and if you did not conform with PCR test or at the private clinic, there's no official reports about your results. So you have to remember, if it's positive, you need a confirmation from the clinic or a hospital, whatever.
Right, I see. Professor, some are calling for preemptive government action, that is, to address a potential widespread shortage of these rapid antigen test kits. Do you believe such action is necessary?
Well, I think with the rapid antigen testing kit, I think the problem is not the problem of productions, but the problem of distributions. So unlike the mask shortage situations in the early and mid 2000s, and the mask is actually very essential components of your protection measures. So, but right now, this rapid antigen testing kit is somewhat more of the complementary measure for RT-PCR testing. So, in this situation, I think the issue is the problem of distributions because of the rapid increase in the demand. So, and at this moment, the government had been working with the producers to come up with additional 9.6 million kits in the local pharmacy, and also 6.8 million kits in the testing and screening facility as well. So I think unlike the mask shortage situation of 2020, I think eventually I think the distribution problem will be subsided. So maybe we don't need the drastic measure to come up with the testing kit supply measure.
Right. Right, and keeping in mind what Professor Ia just said, Professor Kim, what are your thoughts on better addressing the potential distribution problem with the rapid antigen test kits then?
Well, basically, I agree with Professor Lee, but I would like to mention about the flexibility we should have. I mean, if you can do the PCR test, you don't have to go through that rapid antigen test, especially for elderly with underlying conditions. And well, I don't know how it's going to roll out, but if we have enough capability to do the PCR test, I think that will be a priority. If it's not, then you do the antigen test first and then confirm by other methods like a PCR.
Right. Professor, also on this Thursday, healthcare clinics located within neighborhoods will be sharing the medical burden of treating COVID-19 patients. What are some precautions to keep in mind in light of this reality?
So with the imminent increase of the COVID-19 cases, it is quite unavoidable to have the help from the local clinic to participate in the COVID-19 case management, especially for the less severe patients. So that's what the governments are doing. But some of the concerning aspect is that in the local, small local clinic, the movement, the entrance gateway and the movement route of the movement path of the patients, COVID-19 patient cannot be separated from the regular patients. So that is one of the concerns. So, but as we are expecting about 1,000 local clinic and small hospital participating in the COVID-19 response for treatment of the COVID-19 patients. So I think what might be necessary is at least for COVID-19 sampling and testing, screening, testing process, maybe the area, it will be great if the area can be separated or enclosed, because the suspected COVID-19 case patients will be taking off their mask. But also, if you are thinking you are having any kind of COVID-19 symptoms and you are visiting a local clinic, it will be best for everybody for you to make sure to keep the mask on. And it will be important for everyone else who are visiting those clinics as well.
Right. Professor Kim, as my colleague Min Jung mentioned earlier, currently we have 97,000 COVID-19 patients being treated at home. How can we ensure proper care and monitoring of these patients?
I would like to tell you a short case, what I experienced, to share that how difficult it is. There was a patient with abdominal pain. He visited the emergency department. And we got a suspicion of intussusception, which is a obstruction of intestinal bowel. And we need to do some kind of ultrasound, and we have to go on with reduction to ease that problem, to solve that problem. So when we do that kind of procedure, we do the COVID-19 test and confirm he is negative. So he was negative. We did the procedure, and it was successful. The patient had to admit to hospital because sometimes it recurs. So he was in the general ward because he was negative for COVID-19. But about 3 days after, he started to have fever. So we repeated that COVID-19, and he was positive. So we checked all the medical personnel who contacted this patient, and one of the radiology residents turned to be positive because of him. So we are dealing with very difficult cases. So whenever you stay home, I mean, you have to be vigilant from the beginning to the end. And now we have medication, Paxlovid. I would like that our government secure more of these medications and ease some indications to use these medications. So it will ease this high rocket rising Omicron outbreak. And if I can mention more about pediatric cases, it's really rising exponentially. As I was on duty during this Lunar New Year's holidays. But current healthcare system is more like an adult-oriented structure. So let's say for children, the simple blood test, IV line maintenance is difficult. It's only possible for experienced nurses and doctors. And as the medical charge is very unrealistic for this case, we have only few facilities remaining this whole capability to deal with this COVID-19 patients. Clinics and hospitals are facing very difficult time already to maintain these trained nurses and doctors. So I think government has to change strategy and put more focus on children. And for emergency room, we are constantly running out of beds to care for children. So we need a special measure to face this Omicron outbreak in a very urgent time, short period of time.
Right, and within this time, of course, Professor Lee, also this month, Novavax's COVID-19 vaccines produced locally by SK Bioscience will be rolled out. What can you tell us about their efficacy and their potential impact on the relatively small portion of unvaccinated adults that we have here in the country?
I think there has been quite a duration of clinical testing on Novavax. So as for its efficacy, I think we do not have to have much concern about it. And I think with this Novavax vaccines, it is locally produced, and also it is kind of a type of a very traditional type of vaccine. So for some of the cases, maybe it can be quite reliant options as a vaccines. So I think starting from coming month, I think we will have this vaccine available to be rolled out. But as for people or teenagers or school-age children under 18 years old, there has not been clinical testing yet. And it is still undergoing clinical testing in the U.S. So for any of those students in the age between 12 to 17 years old, we have to see yet if we can roll this out in Korea.
Right, and staying with vaccinations, Professor Kim, authorities here have pledged to draw out a vaccination plan for children aged 5 to 11 this month. What are your thoughts, very briefly speaking, on the necessity of this plan?
Always we have to think about the benefit and harm, and it should be balanced. The purpose of vaccination program for children is to protect children or to protect adults or to prevent severe cases coming out from children age group. I would like to mention one thing about our situation, that one of the high risk factor is the obesity, and the situation is different from country to country. We have a report from UK that compared the obesity among OECD countries, and that the high obesity country is Chile, Greece, and USA, and the low obesity country is Japan, Korea, and Slovak. So if it's that the case, I think Korea has less risk for children if we get COVID-19. So the benefit-harm balance is going to be different from the United States. I'm a pro-vaccination doctor, but my opinion is we have to give priority to the basic vaccinations which children should have, like MMR or DPT or whatever. And I think there should be no more class suspensions. And if the vaccine is to protect adults, I think that should be unnecessary for children.
I see.
And as Professor Lee mentioned, I'm waiting for Novavax trial for children.
Right.
Yeah.
All right, Professor Kim, as always, thank you very much for your insights. Professor Lee, thank you for being here today.
Thank you very much.